Hey guys, it's Jeanette. Hope you guys are doing well. Today is Tuesday, and yesterday was my clinical day 4, and today I had my foundations exam 3. It was really tough today. I'm so tired. This is what a sleep-deprived nursing student looks like. So I can't wait to just get a nap in. Anyways, so the exam today, a lot of the questions were on fluid and electrolyte balance or imbalances or whatever, and that's tough for me to understand. So I know I lost a few points on that on the exam today, but I got a high B, which is good. But I noticed that this time around I didn't do what I normally do when I prepare for tests, and I didn't focus on the small details like I usually do when I study for tests. So that probably cost me about 6 points or so, but I'm glad that's over with. So yesterday was my clinical day 4, and what a day. Emotionally, physically, like, it was just a tough day for me. So last week I had a little post-it with the things that I wanted to do, and I didn't do that. So like I actually had to take some time throughout the shift to be able to list out what I wanted to knock out. So when we got there, literally 10 minutes later, a code happened, and the patient didn't make it, and I think they probably passed in the night. I'm not sure, but to start your shifts, like we technically didn't start. So that kind of hit me a little hard, just being so close to it. And then obviously I was there and I observed the protocol, what people are doing, grabbing the crash card, calling, checking the chart for the coach status, etc. So so that happened. My head to toe took like an hour, and so I'm now realizing that I may be doing too of an intense or in-depth head to toe, and I think I'm supposed to be doing it in 15 minutes and just getting out of there. But it was a whole new patient, so there was a lot of talking and trying to get to know her, and she was just recently admitted. She was really nice. I learned, and I caught a kind of you would say a stage 1 pressure ulcer, and that was good that I was able to assess it, and then I grabbed the nurse and talked to her, and she saw it, etc., and I helped put a skin protectant on. So that was pretty cool. And then I also gave my first suppository. What a feeling. One, it was the first medication that I administered, and then having it be a suppository, I was actually excited to have the opportunity to do it, which is kind of weird for those that are not in nursing or in the healthcare field. It went well. It was pretty quick, and it's like, it's not a big deal. So most likely next week I'll probably be volunteering to just give them. And it just went well, and I tried to explain it to my husband, and he's just like, I don't know, he's like, did you wash your hands? I'm like, of course. And then I learned to double glove. So FYI, the nurse told me to double glove. I mean, it makes perfect sense because you have a little like medicine cup, and you put the suppository in there with the lubricant, and you're kind of just like lubricating the tip, and then you lubricate the fingers. Oh, okay, so let's talk about this. So the textbook, or at least how I learned it, have the patient lying on the left side and, flex their right knee up. And the patient was lying on her right side, and I'm like, okay, this is different. Mind you, I am right-handed, so I felt like having to hold the suppository with now both fingers lubricated and, the gloves and suppository. So it was just tough, and I'm like, okay, just grab it and just do it quick because I may actually drop it. So I thought that was funny, and literally, I mean, it takes like a second, and the body does what it does, and it helps. And so I'm just excited. So that was that. I still have yet to do my injections, so I'm hoping that this coming week I get to do my like AccuCheck and give injections. And maybe a peg feeding. I wouldn't mind doing that. Anyways, so yeah, overall I felt defeated at the end of the clinical day. I think because of the whole code and, that the patient didn't make it, and then, I took so much time doing a head-to-toe assessment that my documentation and charting, lacked. And I hate doing last-minute stuff. I hate really writing sloppy. Like, I need to take my time, especially knowing that it's graded and that it's worth a lot for my grade. That's probably the one thing I hate about clinicals is there's no reason why I should be spending 2+ hours charting when we're only there for 6. And in my mind, I'm thinking this is foundations. This is the beginning of everything. We are only at a clinical site for about 6 weeks. We should have as many hours in patient interaction as possible. Leave the paperwork for, finish at the end of the shift, turn it in the next day. Yeah, whatever. But I know they're trying to teach us how it will really be, but still, it's frustrating. So I know that's an area that I need to work on. Like, I don't know what it is. I literally get there and it's like, my mind goes blank on how to say things properly, medical terms to use. Like, it's just bad. So I'll be probably meeting with my teacher soon just to see how she can help me. So I think that's that. I am about to go nap. So hopefully you guys are doing well. It's Tuesday. If you have any questions, leave in the comments below. And hello to Instagram and new YouTube subscribers. How are you guys? And for everyone who's actually getting acceptance letters, yay! This is one step forward, so go ahead, rejoice, celebrate. This is an accomplishment, just getting in. And then from now on, do what you can to get your ducks in a row. Enjoy your free time. Spend as much time with your family. Go on vacations. Because all that extra time you will want to put towards nursing school. A few people didn't do so well on our exam 3 in foundations. And, it's tough. So we were talking about, well, what do we need to do? Do we need to provide, have more time to study or less, etc.? So everyone's different. You will only know how much time you need to devote to a class or a subject or anything like that once you're actually in. So some people are good. They can study, I don't know, a few days and they have the material, and some people need a week or more. So yeah, everyone's different. That's okay. I'm also being, I'm trying to not stress about the little points. And I don't know how much I believe that I'm trying to forget about that, but, my bar, for me personally, is at least get a 90 on exams or above. And for the most part, let's say 3, 4, 5, 6, out of 6 exams, I've gotten 4, I think. Anyways, but yeah, so that's where my bar is. I want to study to be able to get a 90 or above. I want to know the material, be able to answer test questions. But sometimes you just have bad days and some subjects are just hard to comprehend, etc. So today I was like, bar at like 80 or 85, I'm good, because I just wasn't confident with the material. So that's that. Anyway, so yeah, if you have any questions, feel free to leave in the comments below, or you can tweet me at iFitNurse, or you can ask me questions on Instagram, whatever. I'll be more than happy to get back to you guys. And till then, don't forget to comment, like, and subscribe, and share the videos, okay? And I think that's about it. Have a good one. Bye.